Hello guys, I'm Olivia and this is Dama and we are your hosts of the podcast Panic and Me. And today we're going to be talking about waiting lists, right? And in particular, like waiting lists for therapy and like similar things, like that basically. And Dama is currently on a very long waiting list, aren't you? Would you like to talk about that a little bit?
Yeah, I'm on a waiting list for about 5 months for some therapy. And then another one, which is 8 months for very long process therapy within sexual assaults and things like that.
Yeah. And I'm currently on a waiting list for step 3 intensive CBT, which is between 4 and 6 months long. So not quite as long as what you're doing. But it's still a fairly long waiting list, right? Yeah. And I think like that is unfortunately an experience of people on looking for mental health help, right? There's so much waiting. I think like what's important to say is like the lower intensity your therapy, usually the shorter the waiting list. So if you could do like self-help CBT, computerized CBT, group therapy, like how quick did you get your group therapy?
Quite quickly, barely a month.
Yeah, because that's like a step 2, and it was probably about a month or 2 I was waiting for my step 2 intensity therapy, but it's going to be 4 to 6 months for my step 3 intensive therapy. It's a longer waiting list because as you get up the intensities you need more experienced therapists, and there's less of them, and you know there's less people needing the higher intensity therapies, but the demand still like outweighs the therapist, because like therapists doing step 3 stuff, you know, have like 20 years experience sometimes and things like that. And obviously step 3 therapy is longer term, so other people need to finish their therapy and all of that kind of stuff. So I think like my first advice, which I think I said to you, is whether you even if you're not sure if you want or need the therapy, still get yourself on the waiting list.
Yeah. Because you don't want to regret it.
No, you don't want to get to crisis or something and then go, oh, we want help. And I could have been on this waiting list for 3 or 4 months and nearly at the top. Whereas, like, if you're on the waiting list, if you get to the top of the waiting list and then they say, oh, you're ready, like, we can take you on to therapy now, and you're like, actually, that's not what I want, that's totally fine. Because then the person below you will just get therapy a bit quicker. But it's better to just get on that waiting list. I think would be my first piece of advice, even if it's really long. Even if, like, sometimes, I mean, for people going to, like, gender clinics, like the waiting list can be like 2 years. And sometimes like people going for like assessments for autism, the waiting list can be like 2-3 years. It's and it's really hard, right, to be on those waiting lists. And it's something we all experience, isn't it? So how did you feel when they said like the waiting list is 8 months?
I was like, wow, that's a very long time, but you know what? It's okay because I can take a little break from like any therapy and just focus on myself rather than...
So you kind of saw like some positives in it?
Definitely. I was like, I don't have to think about it, I can just get on with my life. Of course I want to improve, but you know, can't speed up the process somehow, you know. So just taking a break. I've got lots of other things that is happening in my life. Really.
So do you think that's like because you've got on the waiting list so quickly when you needed to, when it first came up, you put yourself on the waiting list, so you don't feel so desperate for it now? Whereas if you'd waited longer, then it might get more annoying, I suppose, and more upsetting. I suppose for me, when I was put on the waiting list, like I have a year. The way I see it is I have a year to sort myself out. Not completely, like mental health is a complete process, but I have a year to get myself back healthy so that I can finish my degree. So hearing that there's like a 6-month waiting list was slightly frustrating, because I have 7 months left now of my time off, and I have 8 months left. And depending how quickly that waiting list goes, it might like pop up when I'm already going back to uni. And then it's been of no help. So it was really frustrating, because I need the high intensity stuff, but I might not be getting it in a time frame that I want. And who knows if that will mean like I'll have to, I don't know, delay my graduation another year in the worst case scenario. Or if I'll just have to turn it down because it comes up when I'm so busy, which would also not be great, because I'll have to go straight to the bottom.
Would you be able to postpone it?
I'm not sure. I'd have to talk, I suppose, to iPad, but like, this isn't a great time. Can you, don't know, put me back in the middle of the waiting list or something? But I don't think that's something like easy to do, right? So like, that was a little bit frustrating. So we have like slightly different feelings towards being on these waiting lists. I mean, how would you feel if like you were at your worst and you were told that there was like an 8-month waiting list before you could get help? How do you think you would have felt then? Because obviously you're doing a bit better now.
Honestly, horrible.
Yeah.
I don't know how to answer that question, because I'm not feeling like that.
No, and you've never been like put on a waiting list when you've needed the help right now?
No,
I feel like I have a little bit like that waiting list. And you just feel like I can't cope for that long. So I had also had that feeling when I started medication, and they're like, it's 4 weeks before it works. And I was like, I can't go like this for 4 more weeks. And it's that desperation to do it now.
Yeah, I guess maybe because mine is like a little bit different. I can cope and manage in my own way before I actually get the therapy. Do you know what I mean? I don't like need it now. I can. This is just my case.
Yeah, of course.
Yeah, I can wait, definitely.
Absolutely. So talk us about through that then a little bit. Like, what are you doing in the meantime to help yourself?
Meditation, which we talk about. I've got so much happening.
Just keeping busy.
Yeah, just keeping busy. You know, like doing like your own, finding some resources yourself online. In my case, because I've been sexually assaulted, I'm not getting myself into any relationships that I know I can't handle, and not get in that sort of bad situation or routine. Simple.
So I suppose, like, obviously without going into too much detail, like, are you putting the incident that happened, like, just at the back of your mind? Do you not think about it?
Yeah.
And you're just thinking, like, that's gone for now.
Yeah.
Until I get to the top of the waiting list.
Yeah.
Is that kind of how you're coping? Yeah. And that's quite, like, you know, a helpful thing to do. I think for me, what I done was I looked for alternative sources of support. So I started a peer support group with Mind, which is a year long. This is really, really good, and I spoke about in other ones of our videos. I'm getting like a little bit of psychotherapy from my GP surgery. I see my GP at least once a month, sometimes more. And yes, and like, if I wanted to, I could obviously refer myself to like counselling at other organisations and things like that, because I needed support. It was like it was a situation where I needed help, and I needed it now, right? Whereas like, it's not something I could put to the back of my mind for 6 months.
It always depends.
It's different. Yeah, exactly. Yeah. That's why it's quite helpful. We have different experiences on the waiting lists, I think, at the moment. So I just looked for alternative modes of support. And also like making use of like helplines and things like that can help hold you over for the meanwhile. And you don't have to wait to therapy to start working on getting better. It's kind of what you've said already. It's like, you know, I think I've been meditating 36 days straight now, 37 days straight. I've started like exercising, Pilates and yoga and things like that, walking, using things that I've learned in lower intensity therapies to help me cope, you know, taking my medication, you know, seeing and, you know, just making sure that I'm doing everything I can, eating right, sleeping right and stuff to just keep myself above water until I get to therapy, if that makes sense. The healing can start before therapy starts, and I think is what I'm trying to say. You don't need to feel like because you're on a waiting list, your life has to stop. I know that's slightly different if you're on like a waiting list for say like gender, or if you're on a waiting list for autism or some kind of diagnosis. But again, your life doesn't have to stop because you're on these waiting lists.
Yeah.
You know, if you're on the waiting list for kind of a gender, I don't know what they call it. Is it I don't know, it's like a gender centre. I'm sorry for like messing that up. It's just off the back of my head. It's just gone off my head. You know, you can still start transitioning socially, start getting the support of your family and friends, if possible, if safe. You know, changing your name socially and all things like that can happen before you reach that clinic. And you can also, like I've been doing, reach out for other modes of support, because I'm also a member of the LGBTQ community. So I go to like social events and counselling specifically for LGBTQ people, plus people. And there are some like awesome, you know, transgender charities like Little Mermaid, for example. Little Mermaids, I think it's called. So like, yeah, reaching out. And if you're, you know, if you think you're autistic or any other real, you know, something like that, and you're waiting for a diagnosis, again, life really doesn't have to stop. You can start reading up about what you think you may have.
You can start
doing your own research. You can start trying different coping skills that you find on the internet and seeing if they help, and reasonable adjustments, as in like things need to be put in place in the workplace and studying, can be put in place before you have an official diagnosis.
Yeah, because
it's a disability or a suspected disability. So if you're, you know, pretty certain that you have, you know, autism or another neurodiversity or a mental health issue or whatever, and you don't quite yet have a diagnosis, you can still approach your employer or your you know, university and ask for that support to be put in place.
Yeah.
So it's about being on the waiting list but living your life in the meantime, I think, and not just focusing on this waiting list, because it is demoralising, I think. Yeah. Did you have anything else to add, or? No, I think that's like everything really I wanted to say. But it was nice to talk to you all. Like, subscribe, and we'll see you in another video.
Yes.
Bye. Bye.